Step 3. Female reproductive health. So there are 7 common reproductive health problems which may impact your IVF negatively. You need to be aware of them, and if you have any of these conditions, you need to have strategies to tackle them so that they won't reduce your chance of success in IVF. So these are endometriosis, adenomyosis, ovarian cyst, hydrosalpinx, fibroids, uterine polyps, and uterine abnormality. I will go one by one and explain how they can negatively impact your IVF treatment cycle. Endometriosis, that's a very common condition. Approximately 25% patients with infertility have endometriosis. So endometriosis can reduce your ovarian reserve if you have chocolate cysts on your ovaries, and if you have operation for that chocolate cyst. Second, it can reduce access to ovaries, which may make it difficult to see ovaries when you're having ultrasound scan during IVF or egg pickup. This happens if you have severe endometriosis, stage 3, stage 4 endometriosis, pulling ovaries high up into the abdomen. So also it can reduce your chance of implantation because it does cause generalized inflammation of the uterus. So adenomyosis, the adenomyosis can cause heavy period, which can be a nuisance during IVF treatment. So second is it can reduce your chance of implantation significantly because it does cause generalized inflammation of the uterus. Then it can also cause ectopic pregnancies and miscarriages during IVF treatment. Third condition is ovarian cyst. So ovarian cyst can reduce your ovarian reserve, especially if you have a chocolate cyst, which is endometriotic cyst, or dermoid cyst. If you have operation for those cysts, it can reduce your ovarian reserve even further. So next, it can reduce your ovarian response to stimulation, especially if you have very large cysts occupying space in the pelvis, and if you have adhesions around those cysts, which may reduce your ovarian response to stimulation. You may not be able to produce as many follicles because your ovaries have to be free to produce grow follicles. Then it can make it difficult to do egg pickup because if you have large cysts obscuring view to the follicles, it can cause some difficulties during egg pickup. Fourth condition is hydrosalpinx. That's the fluid collection in the tube. That fluid can be toxic to the embryo, and it can cause infection. So it can reduce your ovarian access if it is very large and obscuring your ovaries. It can cause difficulties during egg pickup, and it can cause infection after the egg pickup. Usually you need to have an antibiotic cover during egg pickup if you have hydrosalpinx. And it can reduce your chance of implantation by approximately 50% because the fluid can flush back into the uterus. It can actually physically wash away the embryo, and also it can be toxic to the embryo. Fifth condition is uterine fibroids. Depending on location, size, and how many fibroids you have in your uterus, it can negatively impact your IVF treatment cycle. If you have a large fibroids, it can reduce access to the ovaries because fibroid can grow with the uterus, and it can pull up the ovaries, and that means that when you're doing scanning, you may not be able to see the ovaries easily, and when you're doing egg collection, your ovaries may not be reachable. So it can reduce your chance of implantation, especially if you have submucous fibroid which is located inside the uterine cavity where the implantation should take place, and it can cause problems during pregnancy if you have a degeneration of the fibroid or torsion of the subserous fibroids. So sixth condition is endometrial polyp, which is a relatively common condition. It can endometrial polyp grows from endometrial lining on the endometrial bed where the implantation should take place. It can cause irregular bleeding, it can reduce your chance of implantation, and it can cause early miscarriages. Seventh condition is uterine abnormalities. There are different types of uterine abnormalities. They're called uterine septum, arcuate uterus, biconate uterus, didelphic uterus. So generally the most relevant abnormality here is uterine septum. In uterine septum, you have a dividing wall hanging from the ceiling of the uterus. That is connective tissue. If implantation takes place on that wall, embryo cannot grow because it doesn't have any blood vessels. So it can reduce your chance of implantation. They can cause miscarriages. They can cause premature labor during pregnancy. So if you have uterine septum, ideally you should have that removed using hysteroscopy procedure so that you have optimal chance for implantation and carrying the pregnancy. These 7 conditions are common, and you need to watch out for these conditions, and you need to have a very clear plans, strategies to treat them during IVF treatment.